There have been at least 70 of these incidents, or at least 70 cases where people have gone to hospital, but there are reports that that number is maybe even higher. So what are the latest figures that you have in terms of how many incidents of carbon monoxide poisoning there have been related to this storm?
So I can speak to Montreal, and what we have as of this afternoon is actually 135 people who have been treated for carbon monoxide poisoning, and that's from 40 or to 42 situations. And so often it's families that are actually getting exposed, and so it explains the numbers. And so that's Montreal, and there have been some outside of Montreal. Fortunately, in Montreal, we haven't had any deaths. There has been one death, as was mentioned before, that was off the island, and we want to keep it that way. So with 135, just to put that in perspective, in a normal year, we get a couple of dozen in the whole year. And so this is way, way out of proportion. And it's really related to a couple of things. One is people using barbecues or camping stoves indoors to heat or cook. And two is generators that are too close to homes or near air intake. So it's really those two things that are the key messages.
Wow. Okay. Those numbers are really big, like you're saying, and obviously much higher than what you would usually see in a typical year. What is the condition at this point, of the people who are being treated in hospital?
So I can't speak to individual patients, but we can say that there are a proportion of those people who had to be treated with what we call hyperbaric oxygen. So that's a specialized treatment to get the carbon monoxide out of their system more quickly. There are people who were found unconscious, who had severe symptoms that could, if not discovered or intervened on quickly, could have led to deaths. And so that's really concerning. So to the overall state, like I said, we're very fortunate and we're glad that there are no deaths to date. But when we have people who are found unconscious, people who have to be treated with hyperbaric oxygen, that's really critical. Those people can have hospital stays with all of the risks that implies. And so we want to avoid as many of those as we can.
This is really serious stuff that you're talking about, and I would imagine that there are maybe some people, perhaps they're going to hear this or see something about this, and they might want to go and check in with loved ones who they know are without power right now. What sorts of warning signs should people be looking for when it comes to possible carbon monoxide poisoning?
Yeah, so carbon monoxide poisoning, carbon monoxide is a gas. It doesn't smell, it doesn't taste, you can't see it. It's produced whenever something is burned. And so that can be a fireplace, it can be a barbecue, it can be a camping stove, it could be a generator, gas, oil, wood. When something is burned, it produces carbon monoxide. When you bring that inside, the carbon monoxide builds up. The symptoms can be really quite varied, and that's one of the things that makes it quite dangerous. But things that people can be looking out for is headaches, nausea, fatigue, feeling off, and that can go all the way to losing consciousness and really, really serious consequences. So for sure, the first thing is, yes, people should be checking in. We know there are some neighborhoods in Montreal that still have more power outages and where we're getting more calls, more situations. Dollar des Ormeaux, which is in the West Island, Beaconsfield and Pierrefonds are neighborhoods in the West Island, Montreal Nord, so the north of Montreal, and Ahuntsic. And we know that some of those people will still be without power probably overnight. So checking on loved ones is super important. First thing is to make sure they know. There should be no sources of combustion in the house, in the garage, in the tempo, in the temporary shelters that people may have over their driveways, nowhere near the inside. Second, if people have been using, for example, a temporary heater or something that may have produced carbon monoxide, making sure they don't have any symptoms that could be concerning. And this is especially the case with people who may have underlying health conditions, so heart or lung conditions, the elderly, and children who may not be able to express their symptoms appropriately. So there's really a wide range of symptoms, but the most important thing is to prevent. And so make sure that people know that the risk is there. And for sure, if you're checking on a loved one, if you're calling up somebody and they seem a bit off, asking that question and making sure they're referred quickly for medical attention if they have anything concerning.